Hi, it's Dr. Arbuckle. I'm here. I'd like to talk to you today about peptide therapy. Peptides are a fascinating new area of medicine. I'm enthralled with peptide therapy. But first, what's a peptide? Well, we know proteins are made of amino acids, and a peptide is simply a short protein made of amino acids. The definition is 25 to 50 amino acids. The first really truly effective peptide is sermorelin, in my opinion. Growth hormone therapy is the closest thing we've come to the anti-aging type of therapy. Well, growth hormone is illegal. There's only two indications for growth hormone therapy. You're a child who's not growing fast enough, called congenital short stature. The second reason an AIDS patient is wasting away, we call that condition cachexia, severe muscle wasting. I've never prescribed it. I refuse to prescribe it, and anybody who will is breaking the law unless you have one of those two conditions. We've been trying for years to figure out a safer way to give growth hormone or to make growth hormone produced from the pituitary gland. The pituitary sits up here in the brain. It's a gland about the size of a walnut. As time goes by, it kind of shrivels back down. The glands tend to be a weak link in the human condition. It's kind of like our automobile, something's going to break first. Well, in the human lifespan, we're just not designed to last as long as we do these days. Something's going to fail first, and many of us, it's the glands. Some of us, it's our thyroid gland, or the pancreas is diabetes. The gonads, the testicles, and the ovaries, they're all kind of fading out. It's all sort of a downhill climb or downhill slide. Growth hormone has many unique, very interesting anti-aging properties. We've been studying it for decades for just that reason. Who wouldn't want to feel young again? They finally figured it out. They were actually trying to figure out how to safely administer growth hormone without some of the negative side effects that are associated with growth hormone. They developed sermorelin. Now, sermorelin goes by many names. One is growth hormone releasing factor. Well, growth hormone releasing factor is secreted by the hypothalamus. That's what signals the pituitary to make more growth hormone, to release more. But not only release more, to store more up. And it's almost like taking that pituitary and fluffing it back up to the size of a plum. We call it pituitary recrudescence. That is bringing the pituitary back to life. What's so safe about sermorelin? Well, if you secrete or give too much sermorelin, your body secretes somatostatin, it shuts it right down. It's very, very difficult to overdose. And in America, we think more is better. I've had patients try to give themselves too much sermorelin to see if they get better results, and they don't. Again, you might as well throw your money down the drain. It really doesn't work better at too high a dose, and that's cool because it auto-regulates itself. Typically, people get effect, but it's kind of a slow climb, a slow road. The first week, the sleep improves. One of the dramatic effects is improvement in slow wave and stage 4 sleep. Well, that's the deep, satisfying sleep we all crave. Who doesn't like to have a great night's sleep? The second week, typically anxiety falls, and that's cool. Again, we're all stressed out. It's nice to have less anxiety. It hits us on all kinds of fronts. Anything that can reduce that is good in my book. By the third and fourth week, we start to see the skin elasticity improve. Collagen production goes up. The skin gets kind of thicker. We all thin out as we age. Lots of really cool, amazing effects in the skin, and that nice thing makes you look and feel younger again. I've had some patients say their hair regrows. Well, hair is really an extension of the skin. And that's also a nice thing to see. It usually takes 6 to 8 weeks to really start to see the body composition change. The lean body mass goes up. the fat cells decrease the size of those cells. It literally causes lipolysis and about a 10% rise in lean body mass, even more so if you work at it, hit the gym and do what you're supposed to be doing. So those are some of the effects. Typically I'll recommend at least a 3-month course of therapy. If 3 months is doing you well, we take it on, we go to at least 6 months. Sometimes we take a brief holiday, many different manners in which we give it, many different mix in which to give it, and we'll dig into that deeper in future videos. This is Dr. Arbuckle at the Fountain of UMD in Virginia Beach. Visit our website. I wrote lots and lots of content. There's lots of FAQs about peptides. We use many different ones. For example, Cimarron, the newer Ipamorone, and the even newer CJC 1295. Very excited about these different peptides and what they can do for us, and very interested at your feedback, any questions. If you like, please subscribe to our channel. We'll be making lots of these videos. I love to talk about this stuff, and I'm very passionate about it. Hope to see or hear from you soon. Thanks.